everyone, my name is Rebecca Okoche. I'm a graduate student of University of Texas in Arlington. This is a teaching and learning strategy class, and I'm talking about reflection. What is reflection? Some will look in the mirror and see themselves as there's a reflection of themselves in the mirror, and I believe what you see is what you get. There's a saying in my place, pictures do not lie, and that's exactly what reflection is all about in the mirror. But in nursing, we use reflection as a way of thinking and also echoing our experiences in a clinical environment. By the way, my clinical environment is the teaching of students in an L&D setting. What do reflection do for us? Reflection also helps us in learning because it's significant to learning, because we are able to query what we come across in a teaching and learning experience. How does that go? Faculty would have given us an enabling environment, set the goals for us, and we also will help ourselves set the goals. But for us to really achieve that goal, we have to query everything and really research our soul and ourselves and relate what we see in a clinical environment with what is in our day-to-day setting. Reflection also permits us to change what we already know. If we have a perspective which we had as an old perspective, when we reflect, we kind of change that perception because we've acquired a new insight into what we already know. That allows us to build also on our mistakes and also on our gaps, if we want to use that word. Reflection also allows us to amend our ways of thinking, because it gives us that impetus to say, okay, this is real, this is not real. I think I need to have that cognitive sense in understanding what is really going on in the setting. It also enables us to connect the school and work and also our home. It's so encompassing that what we do in school could also rub off in our homes and also in our work, because we learn. It's a holistic approach in reflection. It's a holistic approach that has to do with cognitive sense and also in giving us that critical thinking that every nurse has to have. Reflection also helps us recognize that the experiences, like I said, we have is so encompassing, is something we need in a wholesome fashion to progress, do our work diligently as nurses, take care of our home, take care of our children, take care of everything we have, and also do our work and our duties to our patients. And it's also a life experiencing thing. How do we achieve reflection, or how do we go about reflection? Reflection requires that we do journaling. How do we do journaling? In a clinical setting, it's more like a log. In journaling, you would have had your objectives set out for yourself, the core measures you need to have experience upon, and each clinical setting is different. And nothing is always the same. It just needs that reflective or critical thinking to apply everything that is needed to a clinical setting that you're operating in. So journaling is more like giving us that impetus to have an analytic setting or an analytic approach to the instances of things we've seen in a clinical setting. It also helps us to give a thoughtful and insightful meaning to everything we see in our daily journaling or in our daily experiences in a life of a student. What does faculty give us? The same enabling environment, grade our reflective journals, tell us what we need to do to achieve success. And we also have to really go by that, because even though faculty is teaching us, but they are learning from us also, and we are learning from them. So it's a junior and senior learning moment for each individual that is involved in this teaching and learning process. What does the learner do? Write the summary. The learner also has the arguments and the reflective acumen to continue to do the bits of the journaling, because it takes the analytic process, it takes the writing your core measures and also your analytic process of what you really want to achieve. And at the end, the summary matters a whole lot, the summative. The learner will also connect their own personal point of view, because everybody have their own personal point of view, and each personal point of view is correct as far as you back it up with lectures, right? Lectures and literatures to say, yes, this is what I think I know, and this is what I think I need to change in my clinical setting, and also how I practice nursing. And that is true. It also enables the learner in a group discussion. Like, we all are distant learners, we engage in group discussion, and that's how we socialize as students. This is what journaling does for us. And in reflecting what we do by writing it down and also following it cordially, we achieve success in our learning. I will really want to end this by saying that reflection is very, very important in nursing, because it helps us, one, have that cognitive sense of judgment, two, understand that we can critically think at any given time and apply our critical skills, because that's what reflection does for us. It helps you go back and say, okay, how would I have done this differently to achieve success in taking care of the patient, in taking care of your home, in taking care of your family, and of course your community as a nurse. Thank you very much. I have handouts for this presentation, and also if there are questions, we can now address the questions. Thank you, and God bless everybody. Thank you. Bye-bye.